You might be curious if there are any risks related to not releasing a lip or tongue tie. Well, when the tissue is too tight, the tongue's movement is limited, which can cause multiple adverse issues, including the baby's inability to nurse properly, difficulty taking solid foods, and potential speech impediments, chronic headaches, neck pain, orthodontic issues, sleep apnea, or other airway issues. Considering that a child's long-term health can be negatively impacted by oral restrictions, it is vital to consider the risks of not releasing the restrictions. A frenectomy for an infant is a short procedure lasting less than a few minutes, which removes the restricted tissue. Procedures performed with a carbon dioxide laser offer the quickest, most complete results with the least amount of pain compared to scissors or diode lasers. One of the biggest misunderstandings about frenectomies is that the actual procedure is all that is needed to fix a baby with tongue tie. The goal when treating ties is to restore optimal oral function. In addition to the frenectomy, the parents and infant will need the help of multiple specialists to prepare for the procedure and to work with afterward in order to fully achieve optimal function and comfortable breastfeeding. As expert leader in the field of diagnosing and treating tongue ties, Dr. Matthew Rowe explains, the tongue is a complex muscle made up of multiple muscles, and a frenectomy procedure is similar to running a marathon. In order to excel at the marathon, you need to train for it. For best results, it is very important to ensure that flexibility, coordination, and endurance of the mouth are established before starting the marathon, or, in our case, before a frenectomy is performed. This pre-work, or training, when coupled with continued oral training after the frenectomy, provides consistent, predictable results when compared to frenectomies performed without these complementary therapies. Finding the right help is important. There are many types of providers that fall under each broad category, but the most important quality to look for, no matter what type of provider, is that they are specifically trained in the problems and solutions related to ties and oral dysfunction. This means they have gained extra education in these areas. Do not assume that all providers automatically know about ties and oral dysfunction. Ask if they have had specialized training before booking an appointment. A good place to start is with a specially trained IBCLC, speech therapist, or occupational therapist. Any one of these professionals can identify ties and help you find the best body workers and release providers for your baby. The IBCLCs at Milk Diva have all had hands-on, in-person advanced training in working with infants with oral restrictions. In addition, they have had thousands of hours of experience working with babies with tongue and lip ties. The advanced practice lactation consultants at Milk Diva are ready to equip and help families navigate through all the stages of infant feeding and oral habilitation. Please contact us today by calling 512-846-6455, visiting us at www.milkdiva.com, or sending an email to info@milkdiva.com.